Let's look at what causes us stress. The two main sources of stress are major life changes and work. Getting married, moving house, death of a loved one and work are some of the things that can cause us major stress. Other life events, such as divorce, Christmas, going on holiday, are also suggested to be causes of stress. So, how do we know what causes us stress? Well, in 1967, Holmes and Ray studied the records of a huge number of hospital patients. They made a note of any major life events that happened to them just before they became ill. Based on this, they rated the events according to the experiences of the patients. Events that the majority of the sample had experienced were rated highest. This gave the Holmes and Ray Social Readjustment Rating Scale, or SRRS. It listed 43 common life events and asked lots of people to give a score for each. They had to say how stressful each event was personally to them. The score numbers were described as life change units, or LCUs. It was found that death of a spouse rated most highly at 100. Divorce was second rated at 73. Losing your job rated 8th with a score of 47. Changing school rated 33rd with a score of 20. And Christmas was rated 42nd with a score of 12. Following this, in 1970, Ray and some others gave a form of the SRRS to 2,500 American Navy seamen and asked them to complete it before they set sail for military duty. They were asked to note the life events they had recently experienced in the previous 6 months. They followed up on this group over the next 7 months and found the following. Those with higher LCU scores were more likely to experience illness and so concluded that higher levels of stress due to life-changing events are linked to increased illness. But remember, correlation doesn't necessarily mean cause. Bear in mind that these were naval seamen setting off for military duty, a pretty stressful situation. Not all of them suffered the same degree of illness, so perhaps what had happened to them 6 months before also played a part. On the other hand, the levels of illness they experienced may not have been linked to these events. The study also relied on people accurately recalling the events and being truthful when answering the questionnaire. There could be problems here. The sample wasn't necessarily representative of the whole population, so we may not be able to generalise from it. There are also individual differences in how we cope with events. Those with type A personalities may not be good copers, whereas people who do cope are described as resilient. Men and women may react differently to stress. Their reactions may depend on their levels of social support, such as family and friends. I mean, what do you do when you have a problem? Do you talk about it with your family and friends, or do you bottle it up and let it grow out of proportion? There are also cultural differences in the way life events are perceived. This scale doesn't separate positive and negative stressful events. Getting married and going on holiday are stressful, but are usually positive. The benefits outweigh the stress effects, whereas divorce and bereavement are negative stress events. Added to this, the scale doesn't consider the effects of minor but long-term everyday hassles at work. In 1981, Canna developed the Hassles and Uplifts scale. They asked 100 middle-aged people to answer the questionnaire every month for 10 months. This was found to be a better predictor of psychological problems than the Holmes and Ray score, but most of the hassles seem to affect women more than men. The main problems included worries about weight and appearance, rising prices, home maintenance, having too much to do, crime, and the health of family members. When an event causes severe stress with flashbacks and sleep difficulties that lead to ill health, this is an anxiety disorder called post-traumatic stress disorder. This was discovered first after World War I when it was called shell shock. Rescuers at a scene of a major disaster can suffer from this also, just as much as victims of rape or abuse. Counseling has been used to try and help people suffering from PTSD, but for some, it may even make matters worse by making them revisit the trauma they really want to forget. Most of us need and want to work. Indeed, recent research into what makes us happy cites being usefully and fulfillingly employed as a major factor. See, there's something for you to look forward to. But it's not all good. The workplace can generate stress. This is bad for the workers who may become ill and also bad for employers. This is because absentee employees cause companies to lose productivity and money. There are 5 main causes of stress at work. Relationships, meaning your relationship with colleagues, bosses and clients. Deadlines, so having too much to do in too short a time. The environment, is it too crowded or noisy, too hot or too cold? Are workers exposed to health risks such as asbestos or chemicals? And are the working hours long and unsociable? Worries about job security and lack of satisfaction. If your role isn't clear, even that can cause stress. And lastly, lack of control. Not being involved in the decision-making process. And hence, having little control over a major part of your life is a real cause of stress. In 1997, Marmot surveyed over 7,000 civil servants in London. They were asked about their grade of employment and how much control and support they felt they had. Marmot then followed up the medical histories of these employees 5 years later and found more of the lower level employees, those with less control over their work lives, had cardiovascular illnesses. This is at odds with the executive monkey study we looked at earlier. In 2001, Sharbrook found that employees who felt they were responsible for things going wrong at work became stressed. This could suggest that having greater control isn't quite as good as thought. It could also be argued that as things went wrong, the employee wasn't in control. There may even have been factors beyond their control, so it wasn't really their fault. Other studies have shown greater levels of heart disease and other illnesses among the long-term unemployed. There are also genetic differences between people. So for example, some people are genetically more at risk of developing cardiovascular disorders than others. Be aware that this whole area is very complicated. Although not having control over your life does cause stress, if you're unemployed or low paid, you have less choice about where you live. So, you're more likely to live in substandard housing and have neighbours from hell. Or, you may live near a busy road with lots of traffic fumes. If you're poor, you can't afford exotic holidays to reduce your stress. So, you may be more likely to smoke. Although expensive, it's relatively cheap and an immediate source of stress relief. Of course, the bad side is smoking is a major contributory factor to heart disease. If you're poor, particularly if you have a family to feed, you may have to eat cheap food. This often means processed food that has a lot of fat in it and fewer fresh fruit and vegetables. So, we can see that stress may lead to an increase in unhealthy behaviours, such as drinking alcohol, smoking, not sleeping, and taking less exercise. We may also be less able to cope with a situation if we perceive ourselves as having little control over our lives. Some of us see a situation as a challenge, and others see the same situation as a problem that we can't solve. In 1966, Rotter said that the perceived locus of control affects people's stress. Some people feel that events are beyond their control. Things happen because of luck or someone else's fault. Such people have an external locus of control and can get stressed because they feel they haven't got control over what happens to them. Others take personal responsibility for the good and bad events in their lives. They have an internal locus of control and can cope with stress as they feel in control of their lives. Are you an internalizer or an externalizer? If you don't do as well as you hoped to in an exam, is it because you didn't work hard enough? Or is it because the exam wasn't set or marked properly? A study in 1972 showed that people suffer less stress when they think they are in control, even though they may not have any control over the situation at all. Also, bear in mind that lots of studies rely on self-report. When employees are being asked about stress at work, most think they should say that they have stress. If they reported that they were totally happy and on top of everything, they would probably feel guilty. They could think or worry that someone else might think that they weren't working hard enough. Okay, so I'm taking control now. Cut! Cut! I'm off for a cup of tea.